Hello, this is Monique with your Daily Sunshine. Right now, I want to discuss a dirty little secret. It's called bed sores. In my previous video, I had discussed about my dad having an ulcer on his toe. And when you start to see, you know, a wound and it starts to grow and you start to able to see bones and, the underlying things that's underneath the skin, it gets kind of scary. To step back and just to let you know a little bit about myself, I've taken care of both my parents. My mom grew up with, it's just my sister and I. And my mom always told us, well, I can't do for one and not do for the other. So I took care of my mom. And so I had to take care of my dad too. Can't do one without the other. You treat them both. My mom was bedridden. She had multiple sclerosis and a number of other health challenges. So she had to be put in a nursing home. My dad, he's still dealing with his health complications, but he's still as independent as possible and he's at home. So I've had experiences taking care of both parents in two different settings, and both poses their own challenges. Within a nursing home, you have a team. And the team is there and you kind of help lead them, guide them. You're still your person's advocate and get what they need done. But outside, the team is you. When my dad started to get needing a little bit more assistance, I was like, where's that team? I'm like, oh, the team is you. You have to figure it out. I said, oh, okay. So it's still interesting. It's a very, very interesting, very interesting. But back to bed sores. Bed sores can come if, well, for like my mom, she was in a bed, you know, she was in an institution, so they had diapers. She didn't have a catheter or whatever. They try and not do catheters because of UTIs, which is urinary tract infections. So you have to make sure that your loved one is changed. You also have to make sure your loved one is turned every 2 hours. And just with those two, you can get a UTI quickly, and you can also get pneumonia in addition to a bed sore. So it's a lot of things that if you don't stay on top of healthcare and taking care of your loved one, if they're in an institution, that you just have to go and kind of, look around and kind of observe and make sure. It's very time consuming. I know with my family, we just did what we had to do. We went in, we went out, we just looked around. We knew the nurses, we knew who was good, who was bad. And you just try and make it work for you. But staying on top of making sure that the skin does not break down and making sure your loved one is turned from side to side every 2 hours. That's the most important part. Now, for my mom, she had a bed sore. It did get to, it was huge. It was like a small grapefruit, probably the size of my fist. And we had to we met with, I think he was a plastic surgeon. He came in, he removed tissue from one area of her body and filled the hole. So that was one option that we did have. So just to let you know, please stay on top of it. Please stay, you know, please make sure the team that you have, make sure they have an aggressive treatment, because the last thing you want to do is to have it, become very serious, because it can also get infected. So just saying those words, stay on top of it. And this is Monique.